CT scans, which is part of medical imaging. A lot of people don't know that medical imaging has multiple modalities, CT being one of them. And recently, Deion Sanders just broke news that he was battling bladder cancer all this time while everybody was focusing on the draft and this and that. This man was struggling with a diagnosis that he didn't have a clue that he had. He had to keep this from his son so they could stay focused on the draft and still take in all the negativity the stress for his sons, the negativity he was getting from everyone, but he was battling bladder cancer, trying to decide what should he do. So let's talk. I am a CT technologist. I actually do radiology technology, CT, and then MRI. I also do a little bit of mammography, and I was an educator in medical imaging for 7 years. I am a consultant. I still do CT scans, I still do MRI scans. And I want you guys to understand that medical imaging, CT scanners, we are not button pressers. We actually, as you'll see within Deion Sanders' situation, that people come in for medical imaging studies, radiology studies, and they don't know that they have something going on with their bodies that could be so detrimental to them. And y'all, I'm telling you, people come in all the time and they just don't have a clue what is going on with their bodies. But we as CT technologists, I'm going to give you a couple examples of how people can come in for a routine exam. Deion Sanders was going in for his regular routine scan that he does, right? He does this scan every year to get the vascular system because we know he has diabetes, he's had his foot amputated, he has a lot of vascular issues. But Deion Sanders found this cancer through a CT scan. Yes, he wasn't even going in for that and had to deal with all the stress while his sons were dealing with the draft, all the backlash. Stress and cancer do not mix. But he held it together and he did a press conference. If you haven't seen a press conference, please go ahead, check out the press conference. I'm going to put this up behind me because I think this is so important to have. This is the press conference he did, and he included the doctors that he had on his team. Two amazing, very articulate uh, female doctors that they did not pull any punches. They explained exactly how this cancer was found. So Dion went in for a routine scan of his vascular system. We scan people's vascular system all the time. People come in every 6 months, every year for a follow up. I'm going to tell you, I can't count on. I don't have enough fingers to tell you how many times people have come in for a MR or a CT scan just for a headache or just for abdominal pain, and oh my goodness, they are immediately sent to a surgeon consultation, the ER. They're imagine you go in planning a vacation and you just stop and get your CT scan of your head or whatever, and you're gonna leave. Y'all got the bags packed, kids packed in a car, and you're going on a vacation. And all of a sudden, the technologist, the CT technologist or MRI technologist tells you, "Mm, step to the side. We have to talk with your doctor for a second." And then your doctor calls you on their cell phone and gives you this news that, oops, we found something. This happens a lot, y'all. So for Deion Sanders to come on and talk about his diagnosis with bladder cancer when he went in for something totally different, I would love to know how many people have had this happen to them or their loved ones because it's very common for us who work in the field to see people come in and we're just going to do a routine without CT scan or they got to drink a little oral contrast and then we give them a little IV contrast. They'll be on their way. No, they're not. Some people do not make it because by the time they find it, it's too late. His was very aggressive. And because of a CT technologist who knew what they were doing, which most of us do. I mean, we go to school for this. We are not just some press a button, go on, anybody can do it. There's certain protocols you have to follow when it comes to your timing of your contrast. Uh, Imaging, you have to listen to your patient. There are times when a patient would tell me something, and that's not what the doctor ordered. And I'm like, you know what? I'm gonna go a little further down. Already on my table, I'm gonna go a little further down, just a few. And then if I keep seeing it, I'm gonna go down a few more, keep going. I've started at someone's abdomen and they just ordered an abdomen. And the what I was looking at that they didn't know was there was extending further and further down. And I'm I'm gonna call the doctor immediately, radiologist, and say, hey, I need you to look at these images, but I covered extra. And this is what I want everybody to understand that we do in medical imaging as CT technologists. We do not, trying to get this clear, sorry, we do not just press buttons. And if you want to know more about this situation, check out the press conference because I feel like he was really talking to people, especially men, to get their routine exams done. And if you get your routine exams done, you can find things that may not be a big deal or maybe early. And that's what the CT technologist and the CT scan was able to do for Deion Sanders, Coach Prime. He recently came out that he has bladder cancer. And I just need people to understand that many of our patients come through our departments with just a cough or a headache. And by the time we do their quick little 5-minute scan, if that, we can tell if this is serious or not. Ultrasound as well, MRI, those also are used to diagnose and kind of get a clearer picture. His doctor did say something which some people ask, well, why didn't he get an MRI? Well, MRI, when it comes to bladder cancer, and I'll just speak a little bit on it, it wouldn't be used to just routinely look at something. We do MRI when you know you got something. So if that bladder cancer extended into the walls of the bladder, the muscle walls, excuse me, the muscle walls, that's where we would have they would have probably had him do follow-ups to see if this was gone because MRI is very detailed. It gets down into the muscle a lot better with great detail and allows the radiologist to really get a clearer picture. So MRI and CT are not the same. They're used totally different. When people have headaches or abdominal pain or they're just getting a vascular checkup, CT is great for that. It's great to kind of let you know we don't know what's going on, but we had the ultrasound and it's not really conclusive, or we know this person is a follow-up for maybe whatever issue they're having. Like Deion Sanders had the issue of vascular issue. You know, he had his foot amputated, some toes, excuse me, not foot, his toes amputated. So he has some vascular issues. So he needs to have follow-ups to make sure he still has blood flowing through those feet so he can keep it up his legs. You know, there's a lot of vascular stuff going on attached to those toes that were there that aren't there anymore. And Deion Sanders was brave. And if you, you're going to chuckle through this live that he did, this conference. Uh, it was, you know, he's always going to throw some funny in it. And I love how the female doctors answered the question. And they said from the beginning, the only way we found this was because of a CT scan that was routine that we were doing for Mr. Sanders that he gets all the time. But this time, it found something and they referred him to a urologist. So, what is a urologist? Urologist deals with the urinary system. Most urologists, if you go to, I think all men should have a urologist, just like women have a gynecologist. Men should have a urologist. They have urinary issues that are a little different from women, that they need to get checked out at a certain age. And the message that Deion Sanders is giving is be proactive, because if he would not have stuck with his appointments of that CT scan for vascular studies and I'll push it off. I'll do it later. You know, right now my boys are getting in the draft, or I need to be there to coach my team. They need me. Your family needs you. Your children need you, even if they're grown. Your grandkids need you. Your spouse needs you. And following up on those scans is so important. And he's so glad he did it. I know he has so much pressure to say, oh, I could do this later. The last 10 or 5 CT scans were all great. I'm not going to worry about it. I think I'm going to go an extra year and not look at it. If he had not gotten that CT scan, y'all, whew, when he was supposed to, who knows? But I just want to bring to light how a CT scan helped Deion Sanders, Coach Prime, find a bladder tumor that he did not know was there. And it just highlights what we are doing with, you know, our profession, really trying to help everyone see us as the professionals that we are, and how much medical imaging is needed, and to put some respect on imaging and CT and radiology and MRI and nuclear medicine and interventional medical dosimetry, radiation therapy, PET, mammography, bone density, all of them. And we just got a new certification, an assistant to, it's IA to MRI. They do not take the scans, but they actually assist with the MRI technologist, but they get registered by the ART. So they're going to have to do some things to get that registry. Y'all, I am just elated that Coach Prime followed through with his follow up routine scan and that the CT technologists did their job and did their thing and was able to get quality imaging. It takes skill to know how to inject the contrast when people already have vascular issues. The contrast injection timing and making sure that the kidneys can push the contrast out, and making sure if you give contrast, if you should give contrast, if you don't give contrast, making sure that all the imaging is there, the anatomy is there. It is a skill to do CT right, because if you miss the contrast bolus, if you don't get further enough down, because say they ordered a pelvis, but they really didn't want you don't have to go all the way past the pelvic bone. Sometimes technologists do clip the bladder. You're supposed to get it, but sometimes it gets clipped. It's so important to know your anatomy, to know that even when things extend a little bit, because you have tumors that sometimes you cover the bladder, but you don't always see it extend further down. Extra imaging, a little extra imaging above and below the targeted area in CT scan is definitely important, but it's a skill. You got to know what you're doing. You got to listen to patients and say, well, this person is here for this. They said this. Let me make sure I pay really good attention when I'm imaging. So shout out to all my CT technologists out there. Thank you guys for joining us live. I definitely wanted to bring this breaking news to you all because we don't know what anybody's going through, but I wanted to just make sure I wish him a speedy recovery. And also to the CT technologists, my colleagues out there, keep doing it, y'all, and support a technologist.